My name is Dr. H.N. Bajaj. I'm an orthopedic spine surgeon at Max Healthcare, New Delhi, and at Med Harbour Hospital in Gurgaon. One of the commonest reasons for a patient to visit the doctor is pain in the back. And one of the common conditions that causes pain in the back is a slip disc. Why a slip disc happens is a different story. But today I just want to focus on the treatment options for a slip disc. The patient has pain in the back and pain that radiates to one of the buttocks and to the leg on that side. Very often the patient's body is twisted. It may be his first attack or it may be a recurrent problem. Let us examine what happens if it is a first attack. So if it is a first attack, the doctor will prescribe bed rest, a good dose of painkiller medication, some simple physiotherapy, and the attack will subside in the uncomplicated case. But what happens if it is a recurrent problem? What happens if the patient has what is called a foot drop, his inability to bring his toes and his foot up? What happens if there is bowel and bladder involvement? So basically in a slip disc, the spinal cord is pressed by one of these discs. The spinal cord is here and this is where the nerves exit from. What are the options in treatment? There are advocates of what is called the injection treatment, whereas an injection is given into the epidural space or around the nerves to soothe the nerves. Again, this is a palliative treatment and I reserve this for people who cannot undergo a surgical operation. But if the pain is severe, if there is a foot drop, in other words, in what we call a neurological deficit, if the bowel and bladder is involved, surgery is the only option. There are many techniques of surgery. The conventional surgery was an open laminectomy, which has been replaced by minimally invasive procedures, one of which still stands and is called a microdiscectomy, in which a small incision is made and using a microscope or using operating loops, a small incision is made around the bones. These are nibbled off, the spinal cord and the nerves are retracted and the disc is excised. Next day the patient is up and about and is discharged. A more recent trend is endoscopic spine surgery, which is also a minimally invasive technique, but has a steep learning curve and also comes with its own problems. I would like to state that surgery for a slip disc is not the end of the world. The patient can recover, can lead a normal life and be up and about with a good result.